Hello and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I am your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida. And I am joined by my co-host, the amazing and talented nurse practitioner, Hope Gulley.
We are on episode 8. How crazy is that?
That's very crazy. I can't believe it.
I can't either.
Yeah.
I feel like we just started.
But it's fun.
It's so fun.
Yeah. And, again, we do this for... the patients to get some information, but it's fun to do. And it also allows us to address questions broadly instead of just one-on-one, because a lot of people have the same questions. A lot of people want to know the same things.
Exactly.
So I thought the last couple episodes have been a lot of fun. We're really starting to dive into some content now.
Yeah.
So today, Hope Gulley, talk laser to me.
This is my favorite podcast we've done so far.
Talk laser to me.
All the laser.
So obviously that's a funny catch line.
Yes.
But, lasers are very becoming more and more very popular, right?
Yeah, I think definitely as what we're seeing in aesthetics is there's obviously much more of an emphasis on prevention, right? And a huge component of prevention is going to be, people are putting a huge emphasis on your skincare, on your laser. Injectables and everything are in that more natural route now, which is awesome because that's how we've always done it. Kind of getting away from that, more exaggerated look, which I think is really exciting. But really prevention is such a huge topic of conversation for all patients now, which I love. So
it's, there's all different types of lasers. We don't have to nerd out on what exactly a laser is, but
we can nerd out all day.
We can, but every laser has a different thing. There'll be some lasers that target pigments. There'll be some lasers that target really fine lines. There's some that target vessels. There's some that are going to be for resurfacing, rejuvenating. So the thing I always joke about when I talk with patients is we say, hey, we can do these really cool surgeries where we pull, nip, tuck, but if we don't talk about the paint job, so we're going to focus on kind of those type of lasers today, sort of more of the corrective and preventative lasers that are going to help us get as youthful a look as possible. Because, living here in Florida, actually not even just in Florida. I had a patient today who was from Colorado their whole life. And I was like, so did you have a lot of sun exposure? She's like, we were outside every day.
Tons.
And then at altitude, you're not feeling the heat of the sun, so you're not doing it. And she would just say like, yeah, in the summertime, you're outside all day and then you're skiing all winter and you're getting sun and wind damage. So it's kind of wherever you live, but those are, again, some of the different types of lasers, but we will definitely focus on the ones that are going to talk more that we see.
Yes.
Because we don't do like tattoo removal or things like that.
Yeah, and I think that there's, it's just super interesting. And I'm sure we'll have a podcast on like skin health and what does that look like. But really you touched on like environment plays such a huge role. So that's where like education and really preventing that as well and fighting and combating it too. So that's where I'm sure we'll dive into that down the road, but.
Yeah. So we're joking today because in many places in the country, they have what's called laser season.
Yes.
Now, Hope, tell us about what laser season is.
Sure. So a lot of the times if we're going to be doing, non-ablative, ablative laser resurfacing, I personally like to protect my patients from heat. That can exacerbate hyperpigmentation. It can exacerbate, obviously, conditions like rosacea, melasma, things like that. So we want to always be conscious of when, we're doing lasers for patients. So unfortunately, because we live in Florida, it is... it's pretty warm year round, but kind of something...
The sun as well, exposure.
Sun exposure. So, and, when we're talking laser and talking to patients about it, you also have to really gauge their lifestyle too. Like, are you active? Do you like to be in the sauna all the time? Do you use like the hottest setting on your hair dryer? Things like that we have to talk about when we're talking laser too. But back to laser season, I think it's exciting because for us, we really don't have a laser season. It's, you got to be able to trust the patient. It's the right time for them.
It's whatever's best for the patient.
For them. When they can be the most compliant, they get the best out of their results. But yeah, I think it's exciting because we've been doing a lot of like crazy ablation stuff in like the peak of the hottest summer I've ever experienced here.
Now up north in New York where I'm from, no one's getting lasers in the summer. They're all out at the Hamptons or the beach enjoying the sun because when it gets cold, it's crappy out.
Exactly.
So that's when they do that.
So typically if you live like anywhere else but here pretty much, is, laser seasons like fall, winter for most patients. So
let's talk about when someone comes in and they're like, hey, I think I want to do laser treatment. What are some of the things you look at to gauge which treatment's going to be best for them? Like, and this can be based on their age, whatever, but tell me a little bit about how you do that kind of consult.
Yeah, when we're consulting for laser, really it's like very patient led. It's like, what is the concern? I have patients who come in and there's one thing that drives them nuts. Like they're like, this one spot on my cheek has been here since I was a kid and it's driving me crazy. There's also patients that come in, like maybe it's rosacea, maybe it's large pores, maybe it's, pretty intensive like melasma, or just like, hey, I feel like a raisin and I want to not look like a raisin anymore. So it's really guided by the patient. And that consult is a really great time to educate is what I found is patients don't know why we have like a diagonal line across the forehead. And it's like, well, it's actually like sleep lines and things like that, which we can correct.
All the time.
Oh, it's tough. Us side sleepers, it's tough.
That's why you should sleep on your back.
Yes.
I can't.
Sleep on your back. Don't be like us.
Yeah. But I think, like you said, and of course the age, right?
Age.
So someone who walks in their 20s and just wants a little refreshed look for an upcoming wedding might be different than someone who came in their 50s and 60s with a ton of skin damage from sun.
Correct.
Exposure, things like this.
Yeah.
So we'll dive into those as well.
Yeah. It just comes to like, we're fitting the puzzle piece into the puzzle. Like, and that goes in with timing. If we have events coming up, usually that's what drives a lot of patients into, especially like spring, summer is like, hey, I have a wedding like in the fall. I want to get ready. So yeah, I think that's all huge components of it, but you just match the concern to the laser options that we have.
And then talk to me a little bit about, like, say a patient comes in, because we've had this happen before. They come in, they're like, oh, hey, I want a Moxie today.
Yeah. Yeah.
Tell me about like how you would
a consult treat
that.
same day. Yeah. So there are some lasers you can walk in and get. There's some that I'm really not opposed to you like coming in and getting. That would be like your broadband light treatments. Obviously you have your safety parameters of like, you can't have, sun exposure, especially like unprotected sun exposure. There's a lot of, and again, that's lifestyle. You really grow a lifestyle when we're talking lasers too. But what I've learned, I think over the last couple years of just doing a lot more laser is we have to prep that skin.
Yeah, getting skin ready.
Getting skin ready. It's the best. And it's something that you as a provider, it protects you because you're really like preparing the skin. It's the analogy we use all day is like, if a patient comes to me and they're like, I want a halo today. And I'm like, think of it like you're coming to me and you're saying, Hope, we're running a marathon together. And I'll be like, all right, let's go at 1:30. And you're like, wait, but I'm not ready,
Well, because I always say this, you probably won't do very well.
Yes.
Probably wouldn't be able to run a marathon.
Totally.
And you could potentially hurt yourself.
Pretty much like guarantee you'll hurt yourself, and then cause subsequent just complications and run into like a lot more heartbreak than you need to than when you could have just trained. So that's where for our practice and how we've built it in is anytime you come in and you're doing a non-ablative treatment like Moxie, you're doing a hybrid treatment, which is ablative and non-ablative, which would be like your halo. And then ablative, which is your nano, your micro laser peel, and your contour, you are prepping.
All right, cool.
But yeah, and prep depends on what conditions we're going after.
Really. And also what laser we choose may have to do with your skin type.
Definitely.
Your Fitzpatrick, we talked about this before, like the amount of melanin in your skin, or AKA how dark you are. But
yes.
Well, let's dive into the lasers a little bit that we have to offer. And let's start with the lightest one. So
yes.
I mentioned it before, but Moxie. So tell me a little bit about what Moxie is.
So Moxie is a non-ablative laser. What that means is when we talk laser, we could obviously nerd out on like the physics and the complexity of it because I love laser. But think of it as we have non-ablative, which non-ablative aerates the grass of our skin. What that means is it stimulates collagen. It can penetrate to like deeper pigment, which that helps with like fine lines, wrinkles, some slight skin laxity.
Like melasma too.
Melasma is
so
amazing.
So that's the darker areas like that some fair skinned people get when they get sun exposure. You'll see like brown patches.
Yeah. And melasma is also super common and like, hormonally too. So like with pregnancy, birth control, things like that, it happens. So super common. But that being said, Moxie is actually a treatment for that, which is super cool for a laser. Any other time, like it used to be an old school rule of like, if you have melasma, you can't get laser basically. And then Moxie created a space for it, which is why we love Sciton, because they do that.
Take me through, like, if I was going to get a Moxie.
Yeah.
Does it hurt? Do I need numbing? Like,
totally.
What is that?
So we numb topically. So with like a topical lidocaine tetracaine combo for about 30 minutes. Then the actual treatment time is pretty quick. I can do a face and neck in under 10 minutes. So it's a very quick, very tolerable procedure. I'm a huge fan of like, I don't like pain. I don't like heat. I don't like to deal with it. So every patient uses what we call the Zimmer, which is like a blast chiller and it blows. Chiller, Oh, you love the chiller too.
I do. Feels good.
Yeah, it's great. But because I'm saying you had a Moxie.
I did have a Moxie.
Tell us what that felt like.
It was, I'm a wimp. I don't like to be pants.
I would say you were also like the first one we ever did, I think.
Let's get the topical working. Let's make sure it sits on long enough.
Oh yeah.
But super tolerable, like zero discomfort.
Yeah.
And then like afterwards felt a little warm, a little heat.
Yeah.
But there's really not a lot of downtime with the Moxie.
No, yeah.
You get those little bumps called the mends.
Yeah.
So those little necrotic little skin flakes that are going to fall off. And then obviously I was making sure that I was not getting a ton of sun exposure afterwards.
Right, being smart.
And that I would also use some type of protection from the sun.
Totally.
But it was great. It worked very well for me. I don't have a ton of fine lines and wrinkles. So I just wanted something that was going to help tighten a little bit.
Yes.
Tone and, kind of like clear. So it was great.
Yeah, that's awesome. I forgot. That felt like so long ago that we did that on here. But Moxie's an amazing tool to use.
So who's getting Moxie most of the time?
A lot of the times, honestly, I don't have a specific like patient that's getting Moxie, which I love because I think in my mind, anyone can walk in and get Moxie. It's awesome. It's safe for all skin types, safe for melasma. It's a great polisher. So if patients are like, hey, I have a wedding in like 3 weeks, what can I do? Moxie all day.
That's a good point. So 3 weeks is plenty of time.
Plenty of time. You could even do it a week before. Yeah. 5 to 7 days
I was going to
is
say
like the
by
max.
5 to 7 days, my skin was feeling great and it looked great.
It's perfect. Yeah. It's a really nice like glass finish, which I love. And then, downtime really isn't super significant with Moxie, even if you go like a little bit more aggressive, which is fun. So,
well, let's take it one step up higher.
Yes.
The Halo.
My favorite.
Talk to me about Halo.
Halo is like my favorite kid out of all the lasers. So
and
Halo.
It's kind of the coolest to watch.
It is the coolest. It is just the most like mind-boggling. I don't know. It is just so cool. Sciton did such a phenomenal job creating that. But like we talked about with Moxie, it's non-ablative, so it aerates the skin. Ablative laser is like what we think of like old school CO2 or erbium YAG, which is what we use.
So that's cutting the grass.
That is cutting the grass. So that is making the skin nice and even. So what I love about Halo is it is completely custom to each patient. If you have more pigment on this side of your forehead, your settings are different for the other side of your forehead.
So you can it's tunable.
It is totally tunable,
right.
which I can't say I've done the same Halo on two people.
That's
it's
great.
just super fun. Again, almost anyone is a candidate for Halo as well. It just depends on what we're targeting and what the expectation is. But like I had a patient recently who she shared a lot of her experience with Halo, which is awesome. That she was more of like preventative, like we were talking about, but wanted to level up and do a Halo. It's beautiful.
Cool.
It's one of the most stunning things. But you do level up your downtime a little bit.
So what does that look like? What is our downtime?
You'll be pretty sunburned looking. And I don't do like a halfway Halo is what I call it.
So you do a real,
we go for it.
A real Halo.
Yeah, we're going to go for it. My goal is that we don't need to do like a series unless we're targeting something deeper,
Sure. Yeah.
But, I expect about at least 7 to 10 days of looking like a cute little tomato. You're going to be pretty sunburned, swollen for sure, your first couple days. And then the mends that come up, which mends is just that everything the laser hits is like coming to the surface
like
that sloughs off.
Yeah, the necrotic little skin balls.
Yes. And it's sandpapery kind of, but with Halo, it's awesome. What I also love about it is that bonus effect of it stimulating your collagen for 6 months after. So
which is why
just
it's
keeps
the best
giving.
in both worlds.
It is the best. It's so great.
Yeah.
But completely tunable.
The outcomes we've seen are just incredible. I call it the best bang for your buck because you get, again, I think the best result with the least downtime.
Yes, I agree.
How often would someone need a halo?
A lot of my patients do it annually and then maintain with Moxie. I think that's been a really nice cadence. A lot of patients like it, especially because we live in Florida. So,
and then you've also combined Moxie with halo.
Yes, stacking's probably one of my
it's
favorites
different
too.
wavelengths, so we're doing different things.
So we're kind of we're hitting different parts of the skin with different wavelengths, which is beautiful. So you can stack any of the lasers that we have, Moxie, Halo, Halo Nano, Halo Micro. It just kind of depends on what you want to do.
Now, when someone goes home with a halo, what do they have to do at home?
When they go home, I always send you home with the Velez mask, which is such a godsend. That has changed everything about Halo for me.
That cooling mask?
Yes, where you look like Freddy Krueger.
Or Silence of the Lambs?
Yes, it's very scary. Yeah. But it's such a cool mask because when you have Halo, I tell patients, like, you feel like you're standing on the surface of the sun. It is so hot.
It's warm.
Because we ablated you know, so it's going to be toasty. But that mask pulls all that heat. Normally it's about 2.5 hours, and that takes it down to about 30 minutes, which love that. But you go home, we give you all of your post-care skincare, which I love. I'll do like a little plug for Elastin because they're great post-care. Nice. Love it. That's what every patient who gets a Halo goes home with. So basically you go home with like all your instructions. You just wash your face, no scrubbing. We don't want any of those mends to come off prematurely because that can cause
scratch, right? Because that
problems.
can cause scarring.
Yes, scarring, hypopigmentation, which I can't bring back, things like that.
But we go over all this several times.
Like ad nauseum. Yeah.
Because it's very important.
Totally. Yeah. Very, very important. And then, we see you like pretty frequently after your Halo. So,
excellent.
But I make every patient take pictures every day because it's cool to watch.
Yeah. If you haven't, we definitely put stuff on our Instagram before and afters that are pretty impressive. But
it's super fun.
All right, let's go up to the Sciton, which is the company we use.
Yes.
They make the best laser in the world.
The best.
Their kind of flagship or the Contour TRL, which is an erbium YAG. So Hope mentioned it before, old school CO2, mainly used for decades for resurfacing.
Right.
Herb YAG is even better because it throws off less heat. And when you have less heat, you're going to create less inflammation. And it's also going to be more comfortable. So Sciton really nailed it. And so Hope mentioned before, nano, micro, and then the real Contour TRL. What does that mean when you go talk about nano?
Like the levels. So when we talk ablation, what that means, that's our cutting the grass, but we control how short we're cutting that grass, right?
Gotcha.
So when it comes to the terms micro, nano, all those things, it's depth. Yeah. So nano is our little frosting is what I like to call it.
Yeah,
it's
you can even do nano without any topical.
Numbing. It is so comfortable. And you just kind of I just like it. I like the word frosting for it. It's like a weekend peel. It's super quick and easy. Awesome on the hands. That's one of my favorite treatments to do. The neck is super nice too. That's going to be, I'm not going to nerd out on microns and stuff, but it's a pretty shallow laser. Micro is right there in the middle. A little step up. You definitely want to numb. You're going to have your blast chiller with me doing that. And then that's a couple extra days of downtime. Okay. And then there's Contour.
So there's the
Big Papa.
The shock and awe.
Yes.
That's what I call it. And I always find it's very useful to tell people, be straight with them.
Yes.
You're going to
look crazy.
You're going to look crazy. You're going to look like I melted your face off because we are creating a burn. We're creating a thermal injury.
Absolutely.
But we have found a way to do it in the office very comfortably with a combination of localized blocks and topical. I also do this in the operating room. Either with or without a facelift, and we've had some really nice results there.
Really nice, yeah.
But that definitely is something you have to prepare for, and then we see them the very next day.
Yeah,
there's a lot of at-home treatment that you have to do diligently.
Totally,
because we're trying to prevent scarring and stuff.
Absolutely, yeah. And I think the biggest thing with Contour that we've really refined in the approach is that at-home care. So it's we teach you've got to debride, you've got to do all these things, but we also want to protect you against, because you're open to the elements at that point. You are an open wound for about 5 to 7 days, but typically with our protocol, you're back on your normal skincare by day 7, which is pretty awesome. So
yeah, that is great. And again, it's tunable. You can go very deep into the dermis with this. It all depends on what you're targeting. I tend to be a little more aggressive periorally because that's where there's a lot of rhytids. But yeah, the nice thing is like certain areas of the face, you might not need to be as aggressive.
Exactly. It's beautiful.
And then I would say, someone could get it every year if they wanted to, but probably what I would say, get a Contour TRL and then follow it up with like a halo or a Moxie or something.
Exactly. Yeah. I think that's super pretty. And we also combine contour with halo too. Like I can, if like the perioral lines are super deep, we can do a halo and then do like a spot treatment of that around. So it's fun to be able to like mix and match your laser. And that's where like coming in for a consult and coming with a plan, but you will be on skincare for a while.
Yeah. We're very adamant about that.
Yeah. That's a non-negotiable.
Getting skin ready, because I have seen patients who have come into our practice who've had services elsewhere who weren't ready and didn't, had a little bit more sun exposure, didn't know. I mean, that's the other thing. I think sometimes there's a lot of patients that walk into places and people want to treat them and they won't really ask like, hey, when was the last time you were in the sun?
Totally. Yeah. And I think that's where so much education has to be provided, especially with laser, because like you said, we've had people walk in and there's like heartbreak there that doesn't need to be there. And that is completely preventable and sometimes irreversible. Obviously we can help improve as best we can, but if you can spare someone that and spare you that's everything. That's our job ultimately.
Absolutely. So, in another episode, I think we can dive into more of like the photofacial stuff, like the BBL and everything like that.
Totally.
But I think that was a good overview in lasers and what we offer. The nice thing is we have something for everyone.
Yes.
And that wasn't always the case with the technology. A lot of times someone who's darker complected like myself, there wasn't a lot of options. So it's a nice component to add to facial rejuvenation, aside from just filling and freezing with Botox.
Right.
But, again, I think when you come in during the consultation, we find out, which is my mantra, the right laser to do at the right time for you, based on what your needs are. So
absolutely.
Well, cool.
All
right.
Yeah.
Well,
awesome.
It's that time.
All right. My favorite time. We get to talk about, let me find a question. I have like my whole list up here. So what?
She always asks me the hardest question.
I do. It's really, I try to keep you on your toes a little. So what's a fictional villain you secretly root for?
Wow.
That's a good one.
That's a good one.
I will say props to ChatGPT for coming up with my questions today.
A secret villain?
Yes.
Well, a villain that I root for, without a doubt, always is Darth Vader.
Oh, that's a great one. Yeah.
I root for him because I know deep down he was good. He ends up being good, obviously.
And it's,
But I do like that he's such a badass.
He is a badass.
When he walks in. Like I was thinking about this the other day. They have that like Imperial March, like dun, dun, dun. I'm like, maybe when I pass away, I'll have that play in the church as they're entering.
You cannot do that in the church.
Yeah, I probably couldn't do that. But
I was going to say, that should be your OR walk-in song, though.
And in all the Star Wars movies, when they play that Imperial March, it's like, and then he walks in.
It's just like, empowering.
And of course,
you're like,
I can't do it, but that James Earl Jones voice is just, it gets you. So I root for it.
How about you? I asked the question and I don't know how to answer the question. I would say.
So movies you watch.
Yeah, movies I've watched.
Who you're like, I think they're misunderstood.
I mean, I don't feel like he was the bad person. But I kind of feel for Gaston a little bit. And I don't know why that came to my mind. But,
he was
he is the worst. Yeah, he's like disgusting and the worst. But at the same time, you're like, he may not have known better.
That's
he
true.
had all the attention of the town.
You don't know how he was raised.
He didn't know. You don't know the background. He just needed a chance.
Honestly, I'm gonna look at that movie very differently now. From the perspective of like,
now I'm gonna get like blasted for being like Gaston's the best.
I do like Gaston. Yeah,
he's a character, but
Yeah. All right.
Was he perfect? No.
Excellent. All right. Cool. All right. Well, this wraps up Talk Laser to me.
Yes.
Thanks, Hope.
Anytime. It's a pleasure talking laser.
Again, if anybody has any suggestions, questions at all, info@patrickbasilemd.com. We love your comments.
Yes.
They just give us great ideas and love all the support.
Yes. And, it's been fun.
We look forward to the next episode.
Perfect.
Take care.